Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And this week, we're discussing the lab.
Yeah, the unsung heroes of clinical medicine.
Do you call them the boys in the lab? Is that like an old-fashioned
since they're
thing?
all women. No.
Okay.
But they were so excited when I walked down the hall and said, "Tell me about your job."
Oh, wonderful. Oh,
Yeah.
That's really, really cool.
Yeah, they were super excited.
So I just want to say, you're talking about the specifically experiencing the lab at Open Door, right?
No,
Is that where you were?
actually,
Or
I was
UIHS?
thinking UIHS.
Oh, okay.
Yeah.
Okay. I had it backwards
Yeah.
because I've nothing but good experiences with lab people at Open Door, so I was gonna sing their praises. But yeah.
Oh,
so,
yeah. But they're my colleagues too. But I didn't talk to him specifically for this. So,
Okay.
But so medical labs are a place where tests are done on clinical specimens, to obtain health information for providers and patients. And some of them are really tiny, like the one we had at Redwood Urgent Care was probably smaller than a bathroom.
Really?
Yeah.
Really? What was in it?
Well, I'm getting to
Okay,
that.
okay,
Yeah,
I'm just-
that's
all
an
right.
exciting question.
Yeah.
So what happens there mainly is they process incoming specimens and then they send them along for other testing.
Processing incoming specimens, and then you send them along for other testing. Okay.
Right.
So
That's in the smaller ones.
Gotcha. Right.
And then in the bigger ones, like say tertiary care university hospital, those so their lab is broken down into about 6 or 7 other component labs,
Right.
and each of them is probably they could be about as big as a normal lot for a house, really huge, and kind of located within different parts of the hospital.
In those larger hospitals and with more specified labs, how do they break up their lab then? What is do you have like a genetics lab?
It's
or something?
almost like you read my mind, so we're getting to that.
I have. Okay.
Yeah.
Well, I keep asking. Okay. All
I know
right.
you're
I'll just
asking
shut
all
up.
these exciting questions.
Well, go ahead. You just you read your stuff. I'll go get some coffee.
Yeah, okay, yeah. So they all share the initial primary goal of data entry into the computer, Snoozeville, in my opinion. But 2 main points of information are what test specifically needs to be done and what diagnosis is associated with that. And none of these are in English, okay? These are all numerically encoded into the computer. It makes it kind of hard because oftentimes this is a point where insurance companies stop turning things down. And it should be noted that these labs are an example of applied science, not research science. Okay, so research has figured out what needs to be done to get certain information, and then these labs exist as science in motion, I think. And I think that's kind of cool, actually.
Yeah.
So most small labs, getting back to small labs, are what we call CLIA waived. So a CLIA is an acronym for Clinical Laboratory Improvement Amendments. And what that means is the kind of testing that they are doing is so straightforward and so, air quotes, easy to do that it could be done at home even. Okay. There's nothing super special about the equipment they need or the training of the people doing the tests.
Wow, okay.
And these are things like pregnancy tests or urine dips, things like that. Both you could buy over the counter and do it on yourself at home if you felt the need to.
Okay.
So that's what the small labs are. Most of those small labs have as their primary purpose processing specimens to get them out to bigger labs. Okay. And for example, the one in Klamath, tiny little lab in Klamath, about as big as your bathroom, they're sending out your blood sample via courier and then plane to bigger labs in like Sacramento. I think that's kind of cool. Like your blood cells are in Sacramento tonight, Anyway, but the larger labs are more interesting, and they have a bunch of different kinds, like you noted. The first one, my favorite, is the anatomic pathology. So if you get a biopsy specimen done, that's where the skin lesion or gallbladder or something surgically removed or autopsies. That's where that happens. And then those involve kind of the scary morgue-like environment, that most people think about when they think about autopsy suites, and also involves a lot of specimens in like formaldehyde and clear jars,
Okay.
and things like that. So if you can imagine, some kind of doctor show on TV. And then microbiology that's where they look for causes of infection. So that's where they can do viral cultures or bacterial cultures, and probably do things also kind of on the level of actual type of specimen. So urine cultures or wound cultures. So those are the ones actually I like the best.
Why is that?
Because I like pus, I like germs anyway. And the people that take care of those labs are not necessarily physicians, but we'll get to that. Chemistry, we talked about what chemistries are. These people work in front of big machines, and they put either serum or plasma, they pipette things into little ampules, probably a better name for that, and they stick it in a machine, and then it pops out with like somebody's potassium reading, stuff like that. These are kind of interesting because you don't hardly ever do a chemistry of a single element. It's usually made up of like 20 elements. So like sodium and potassium and protein and liver function tests. And it's kind of weird because it's cheaper to do like 20 things at the same time on this machine than it is to do things, bit by bit. If you're only looking at the potassium, you get a lot of other information that's probably
I got you, because
relevant.
it's just cheaper to run it the way it's
just
made
cheaper
to be
to
run.
do. It's like cheaper to buy a dozen eggs than it is to buy one
right.
egg or something. Anyway, so that's what that looks at. Hematology works with whole blood testing, like doing blood counts, and that's not only putting it on the machine, maybe spinning something down, putting it on the machine, and then, getting a bunch of different results. It could be also sitting at the microscope, which is kind of exciting. So they do things like blood counts and coag levels. This is where I have experience. I worked in a coag lab, third shift, for a long time. Super exciting, because when I did it, it was in the beginning of liver transplants. And liver is responsible for at least the most important parts of coagulation of blood. And so if somebody was getting a new liver, we would do coag studies on them every 15 minutes all night.
Wow.
Yeah, super exciting, very science fiction-y. And then the blood bank, which we've talked about before, which is a whole section in of itself. And it's, of course, responsible for taking care of donated blood and platelets. And then what they do is they primarily make sure transfusions are safe. They type blood and they look for maybe antibody or antigen reactions that could cause a problem, but they also package it to send it out for research. That's what I don't think we talked too much about it when we talked about the blood bank, but some of the blood that you're donating to them is actually getting sent to Europe for research projects. It's not only 100% here, like saving your neighbor, although that's the majority of it. Kind of interesting.
Okay.
Yeah. And then molecular diagnostics. I think you did something like that, didn't you, in the past? No?
I don't know.
Okay.
What is it?
So it's like genetic testing, say a pregnant woman would have done, or a child might have done, or a couple might have done before they conceive. And this is where the famous gender test happens. And so that's when I'm taking care of an OB patient and they're greater than 10 weeks pregnant, they're always asking for the gender test. And so that blood sample gets sent away, and it looks at about 50 genetic diseases that could be present. And then also it's either presence of male chromosome, which is male, or absence of male chromosome, which is how they define female. Yeah. And so people get confused about how it's reported out. So I always try and remind them.
People get confused about what?
Well, they don't interpret it. They expect it's going to come back male or female.
Oh, right.
And it's either absence or presence.
Gotcha.
Yeah. So, but everybody's excited about the gender, but I'm excited about the 50 other things that tell me your baby's going to be okay. Yeah. So, and then the last kind of lab is reproductive technology, which mostly oversees fertility diagnostics and procedures. So, And so, but this is where the interesting part is, and this is where it's relevant to Del Norte. Okay. So who staffs labs like this? Well, most labs that I've worked in are overseen by a physician who's trained in pathology. And pathologists are kind of interesting people. They oftentimes prefer their patients to not be very interactive, obviously. I mean, they're nice people and everything, but they like the quiet of the lab. They like, they geek out on the science.
So, yeah, what sorts of things is a pathologist looking for then? And how does
Well,
that differ
the big
from-
one is cancer. They're reading all kinds of slides or looking at biopsies or looking at autopsies to look oftentimes for cancer. And so they're highly trained. They have to take fellowships in it, which means extra schooling. And they almost never see patients directly, which I think is kind of interesting.
You'd be looking at data then. What's the, do you specialize as a pathologist?
Yes.
Okay.
You can. And pathologists tend to stay in the same job forever. Like
I guess I meant as a pathologist, do you specialize in a certain pathology? Like I'm going to go be a cancer. I'm going to be a cancer pathologist, or are you just looking for pathologies?
I think people have interests, but the ones that are taking care of these labs have to have knowledge base for a
Kind of
lot of
across
different
the land.
things.
Yeah,
Across the
okay.
board. And interestingly, most of the pathologists that work in the 2 counties, there's probably like 5 of them, maybe.
Wow.
Less than 5. They stay in their jobs forever.
Yeah.
Yeah.
It sounds kind of low stress.
Yeah.
If you're just
Yeah, you put the earbuds in, listen to a podcast.
It's like what was that like 20 years ago, 30 years ago, whenever it was like the least stressful job was some sort of insurance adjuster where you're just looking at data all day and you're not
Right.
dealing with people. This sounds like the medical equivalent
It's kind
of
of
the
the same thing, but if you think about it, you're looking at a slide that's going to call somebody's life. Okay.
Yeah, but I
so
don't
it's
think
either going to be
day-to-day-
cancer or no cancer.
Right.
So they have to be highly trained, and they have to. There is a bit of responsibility more than I think average, more than you would think.
Yeah, okay.
Yeah,
All right.
it's kind of a big deal. And they're a little weird too. The ones that do autopsies.
Oh, yeah.
Yeah.
The ones that do What's
They are very geeky people.
Yeah, right.
But they're also very highly trained, but like the goo and the smell doesn't really bother them. Anyway.
Is that the thing? You see the thing in the when you like some cop show, right? Where they're
Totally.
where
everybody's feigning and the pathologist is
like,
going,
what?
What's the problem?
That's what it's like. Yeah. Okay.
Oh,
That
totally.
that makes sense.
Totally. So the next in line, typically under the pathologist, is a medical laboratory scientist. And this is a great job for the right person. Number one, for a science person who's really interested in the idea of helping people, but content to be a little bit behind the scenes. This is a well-paid job, something that you can get the education for. And then the cool thing is that there's a lot of openings. And it's people can be competitive about where they, what job offers they get.
Did they attract like young folks just out of school, that kind of thing?
God, they should.
Yeah, right.
But this is underemployed.
Wow, that's
Yeah,
too bad.
so this is part of what I wanted to talk to you about here, because all these jobs right now, after the medical laboratory scientist and then the staff that person is managing, those are all like wide open jobs.
What sort of degree do you need as a medical?
You're probably going to need a master's, and it's possible, depending on how specialized you are, you might want a PhD, but definitely
Really?
a master's. And it's a master's in medical laboratory science. Okay.
I'll be damned. Okay.
Yeah, so it's not like rando degree.
Yeah,
There's a
yeah.
specialized degree. And that's why this is so important, because I don't think people know this exists. And there's somewhere in our listening audience is, somebody who's in high school, maybe getting closer to thinking about what they want to do with their life, and would fit right in here if they
Right.
knew it was a thing.
But doesn't necessarily want to be a doctor per se.
Right.
Right. That's wild. Wow.
Or get a doctorate. So then, there's a certain amount of people management in this, because these people are usually like running the lab.
Yeah,
as
you're
far
the
as-
manager.
You've got a bunch of, so you're not only in the science of it, you're in the people of it, but that way in the people of it. So I saw a lot of variation in pay, but what my lab friends told me is it's probably $100K.
Right.
Yeah, so that's great. So under the next in line under that person is kind of a gray zone. It's called a medical laboratory tech. And then underneath them is a medical laboratory assistant. And those are both kind of gray zones because people are kind of doing tech stuff but being paid for assistant stuff.
Right.
So I don't think those are spectacularly well defined and kind of can be changed around probably by HR people, because the difference is about $60,000 a year for the medical laboratory tech, and then the medical laboratory assistant is probably around 30.
Yeah, that's going to be like minimum wage.
Yeah, it's like a huge difference.
So I worked in a lab. It was not. I wouldn't say a medical lab like this.
It was research.
It was a research lab, and it was broken down much like this. And it was a genetics lab, but it was research. You had, I guess the equivalent would have been. It's like the medical laboratory scientist, the person in charge of the whole lab, was. Yeah. I guess maybe there's a level of management that we didn't have, but we had what was, I would assume, would have been the medical laboratory scientist, which probably wasn't them, but we had research associates, they were called, and they didn't need a graduate degree, so maybe they are more in line with the laboratory tech, but they were called research associates, and you just needed a BA in science and
Right.
to know your way around a lab.
Right.
And then under them, they hired, and this is what I was because I had a degree in English, tech. It was a lab tech is what they
Right.
called. And that was,
Exactly.
they referred to us as shaved monkeys. It was basically you show us how to sequence DNA and then they can go home for the
Right.
day and we do it the rest
Medicine calls it a scut monkey.
Yeah.
So what I was told by the people that I work with every day, that sometimes they're called to stretch a little bit, even though it's not necessarily in their job description. But
Right.
aren't we all?
Well,
know?
yeah.
And then
And I imagine in a lab
Yeah.
too, especially in a lab in a smaller community, in a smaller facility, you're going to have like lots of gray area as far as that
right,
division.
and people are gonna, like the Klamath lab only has a single individual
Right,
working there,
right.
and so she's probably called upon to do stuff.
She
a
takes
little
out
on-
the trash too, I
yeah,
assume, right?
a little on the periphery of what her job duties are. And, I should also go back and say that the medical laboratory scientist, so the person who's kind of administrative over all this, is probably administrating several different sites. So in Open Door and UHS in particular, you're talking about labs in Smith River, in Klamath, in Crescent City, in Padua, probably more than one in Eureka, maybe Fortuna.
So do you have one person overseeing all those labs?
Yeah, all of
Okay.
those labs. So it's kind of an intense job. You could say the same things about Open Door. Multiple sites. Because I know when they have to actually come up here and make an appearance, they have the same problem that anybody else kind of home-based in Humboldt County has, trying to get out to the
Right.
nether regions. So the next, kind of on the lower part of the totem pole, but a good place to start if you're that bright, first semester senior at Del Norte High, is the phlebotomist. So a phlebotomist 1, they call them CPT 1s, draws venous samples, and then you can get a little extra training and work your way up, and a CPT 2 works with drawing venous and arterial samples.
Ooh.
Yeah. So arterial
Is there that much of a difference?
Yeah.
Really? What's the difference between venous and arterial samples?
Pressure.
Okay.
That spurting blood
Right,
thing,
right, the
bright red
arterial,
blood.
right, yeah,
So you
okay.
kind of got to know, how not to do that.
I thought they'd just have everybody prepared for that eventuality, but yeah, okay.
No, not really.
What happens if it squirts at you? That's next year.
Yeah, you duck.
Practice changing babies. Baby boys. Here
I
you go.
know, pressure. Anyway, but again, here's why labs are so fascinating, why that's important for Del Norte, because there are way more jobs for this. And I know when we have somebody who moves on in our lab, it takes them a while before they get somebody else
Wow.
in. And this is a really, really good place to get into medicine for the right person who wants to either work their way up in laboratory science or consider jumping to another part of medicine. And here's the reason that I mention it. Reasonable salaries, okay? Way to help people medically without dealing with people directly most of the time. Because that's what they said in the lab, is they kind of are happy. Most of the time when they deal with somebody, they're either kind of faint from a blood draw, or they're having problems with getting insurance to pay for a particular test because the coding isn't right.
Gotcha. Okay.
So those are two times when people are either scared or frustrated. But most of the time you don't have to really, the interaction's a good one.
Yeah, yeah.
So especially, I know, especially some of the best blood drawers in the Open Door and UIH system are really, really appreciated in the community. And there are people like, nobody's drawing my blood but Tammy.
No. I've seen that happen at Open Door.
Yeah. They need somebody who's into science, okay, and who is meticulous and probably, I would add now, has some computer experience.
Oh, of course. Yeah.
Yeah, totally. But here's the thing. Rumor has it that CR is starting a program. They already have a phlebotomy program, but they're starting a program for the medical laboratory assistant.
Wonderful.
So,
wow.
But it's taken forever. And I guess in my provider mind, I'm hoping that it's not falling by the wayside.
Is it, could one reason it's taking forever, are there readily available, like widely accepted certifications for this work? Oh, okay. I thought they were having to invent the wheel,
Oh, no.
Okay.
And, in some of our listener areas like Klamath Falls, there's probably this education is available, but not here, not in Brookings.
Nope.
Maybe in Humboldt, but I would doubt it. I just think that this would be it would fill such a great need for the community, and it would give high schoolers, who are of the mindset who could be successful in this, a dream. And they don't really have to stay here to get the full education if they're going to march all the way up to this could take you to be a physician, to be a PA, or go into, an indirect route into nursing perhaps, or medical education. This could go anywhere, and it's a good way to earn a good living.
Yeah.
And then help people.
Yeah.
But nobody ever thinks of them.
And it's stress. I know firsthand, it is stress-free work. You're just in a lab and you're following a recipe. It's like, as on the tech level, right? When you don't need that kind of, but even then, people with a science degree, and then you can get right into something. And then it does buy you, like, you can almost take a gap year, get a job, do something like this, and then figure out if you do want to go on.
Oh, totally.
For a while, thought about going back to school and getting, because I got really into my job when I first got it, because it was so interesting and I'd never done anything like that before.
You're virtually never on call.
Yeah, exactly.
Nobody really knows what you do, so nobody's going to stop you in the produce department of Safeway and go, hey, what was my fecal occult blood sample?
Yeah, exactly.
And I don't know. I just think,
and even through the course of the day, I was just left alone to do my job. It was really nice. Nobody's looking over my shoulder. You get the results, and people look at them. And your boss can look and go, "Okay, you're doing science. I can see." And nobody. Yeah, it was a good job.
You ran the controls. That counts for something. It's a little bit like, remote working, but being in the office. Nobody bugs you. Nobody bugs you except confused providers every once in a while.
Wow.
But the people in the lab were so excited that I was going to do this and talk about this and the potential of a CR class. And, they all have dreams. All those women, they're 100% women. They all have dreams of moving up.
Really?
And doing, going for the coveted management position. Wow. Not too many interested in actual pathology, but they're not doing that every day. We don't have an autopsy suite up here, but that I know about.
That's an ominous thing to say.
I know that is. It's also weird. I shouldn't be that interested, huh? But
show me your autopsy suites.
But I would say if there's a bright young thing out there who goes, really? See, this is maybe a thing at CR? Yeah. Why don't you call him up and ask him and express interest in it?
Let him know, yeah.
So
you say it's been I'm sorry, I'm interrupting you left and right. Please go on. I'm sorry.
It's The CR has for so long really focused on nursing, but there are so many things up here that and Lord knows the medical community needs that.
Yeah.
But there are so many other things up here that go into providing care for patients that really need to be addressed. And it would be lovely if CR could provide that kind of education for people to at least get a start. And whether these people are going on to, PA school or anything else that seems to appeal to them, this is a worthy start. This should happen.
Yeah.
And I think if people call up and bug them a little bit,
Contact
say,
CR. Let them know you
yeah, I'm
want to see this.
super interested in this. When's it going to be again?
So do you have? What I was trying to get. Going to interrupt you about was. Do you have any insight into why it's taken so long? I guess we got off the topic. I asked if there were certifications or certifications.
Well, I think
available.
the nursing educator profession is really focused on being the top of the pile, which is not a bad thing. We need
they
nurses.
they developed the LVN program.
Nurses are super good at defending their turf.
They're
Because
tough.
I know I've been in meetings where I've said, "Hey, we should do this," and was definitely shut down.
Yeah.
Yeah, never invited back.
People, yeah.
Yeah.
Nurses are tough, and rightly so. They have to do a lot of the heaviest lifting.
They totally do, but you could also use this as a jumpstart to a nursing profession.
Yeah.
If you wanted to. Although this is kind of a medical arena, but I mean, whatever.
Any lab based sort of you
Right.
could take that, right? I mean, my daughter's getting a PhD in neuroscience, and it's not a neurology PhD. It's more of a study in neuroscience, neuro research PhD. She's looking. I think this is exactly where she's going. She's looking to be one of those lab managers. That's what she's doing right now. Or
Yeah,
not
that
what
would
she's
be
doing
so
now,
cool.
but working her way up.
Especially because I think right now she's living in an urban center. So can you imagine the size of those labs?
Oh wow, yeah.
And she's probably
She's right. She's at University of Washington. Yeah.
UW. So that person, they probably have more than one person in that role with that education, and they're probably managing hundreds of people in multi-million-dollar budgets.
Yeah,
And
yeah.
amazing, like one-of-a-kind testing that draws people from all over the world.
Right.
And then, they have, I don't know, I think the potential is unlimited if somebody really wanted to run with it. And she's an example of a bright high school student here in Del Norte who was science interested and ran with it. Oh, not science?
I have no idea where the science came from. I always thought she was
okay.
gonna go. She was humanities all the way. She's
Okay,
a fan.
latently,
She
scientifically.
graduated, told me what she was going to major in college, and I'm like, what? That was the first I'd ever heard
where
of
did that come from?
I have no idea where that. Actually, I know exactly where that came from, and it came from. Oh gosh, when was that? When would that have been? Avi is what, pushing 25 this year. Well, it's 24 now. So what? Anyway, Avi was 6, so we're looking almost 20 years ago. And Madeline would have been 8, 9, 9, 10, 9. And Avi had a heart murmur that somebody heard here. We had to go to OHSU up in Portland and spend 2 days in Portland while they did this laparoscopic thing and went in and did like heart surgery on Avi.
Oh, God, how scary.
Yeah, it was
scary.
It was scary. It was scary. But Madeline had a blast because we're in this hospital, and it was the kind of place like she'd go, "Hey, I'm going to go wander off," and she'd do that, and it was like a kind of a closed campus kind of thing where we were, and she'd just go and ride elevators, and she went all over this hospital and walked the walkways between buildings and was looking into labs. She said that's the moment she's going, maybe I want to do science.
Yeah, this is cool.
Yeah, it was kind of cool that way.
Yeah.
So,
A similar thing with my youngest. We walked around Lucille Packard in Stanford, and she kept trying to sneak into the surgical suite. But what I'm saying is there are Del Norte kids here who deserve this opportunity, and this is amazing.
Yeah, that's wonderful. All right. Yeah. Well, any thoughts about next week?
I don't know about next week, but 2 weeks from now, I'm going to have a young woman on interviewing a colleague of mine when I worked at Redwood Urgent Care to talk about the other program that CR is thinking about, which is X-ray technology.
Oh, wonderful. Yeah, I remember that being a deal. Okay,
Stuff happening.
Stuff happening. We'll find out about that in a couple of weeks on Health Matters. Lynn, thank you.